Felodipine Er is a medication used to treat high blood pressure, also known as hypertension. It helps lower high blood pressure to prevent strokes, heart attacks, and kidney problems. Felodipine Er works as a calcium channel blocker, which means it relaxes and widens blood vessels to allow blood to flow more easily. It is typically taken once a day, and the best time to take it is usually in the morning. The dosage will vary depending on individual needs, so it's important to follow the instructions provided by a healthcare professional. When taking Felodipine Er, it's important to follow your doctor's instructions. Typically, you'll take 1 dose per day on an empty stomach, but if it upsets your stomach, you can take it with a light meal. The dosage will depend on your medical condition and how you respond to the treatment. Remember to swallow the tablets whole and not to crush or chew them, as this could release too much of the drug at once and increase the risk of side effects. To get the most benefit from this medication, take it at the same time each day as directed. Even if you start feeling better, it's important to keep taking it. Many people with high blood pressure don't feel sick, so it's important to continue taking the medication as prescribed. It's also important to note that this medication is not effective if you only take it when you have chest pain. You should take it regularly to help prevent chest pain. While taking Felodipine Er, it's important to avoid eating grapefruit or drinking grapefruit juice unless your doctor or pharmacist says it's safe to do so. Grapefruit can increase the chance of side effects with this medication. Finally, don't stop taking this medication without consulting your doctor. Stopping suddenly could make some conditions worse, so your doctor may need to gradually decrease your dose. As your body gets used to Felodipine Er, you may experience dizziness, lightheadedness, headache, flushing, or stomach upset. If these effects persist or worsen, notify your doctor or pharmacist. To decrease the risk of dizziness and lightheadedness, rise slowly when getting up from a seated or lying position. It's important to remember that this medication has been prescribed because your doctor has determined that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. While it's unlikely, Felodipine may cause mild swelling of the gums. To minimize this issue, massage your gums and maintain regular dental hygiene. See your dentist for regular checkups. Notify your doctor immediately if you experience any serious side effects, such as swelling of the hands/ankles/feet, edema, fast/irregular heartbeat, or fainting. Although this medication effectively prevents chest pain, angina, some people with severe heart disease may rarely experience worsening chest pain or a heart attack after starting or increasing the dose. Seek medical help right away if you experience worsening chest pain or symptoms of a heart attack. A severe allergic reaction to this drug is rare, but seek medical help immediately if you notice symptoms like rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of potential side effects. If you notice other effects not listed here, contact your doctor or pharmacist. In the U.S., call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. Before taking Felodipine Er, it's important to let your doctor or pharmacist know if you have any allergies, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have heart disease, liver disease, or swelling of the arms and legs. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Felodipine Er may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid driving, using machinery, or any activities that require alertness until you can do it safely. Limiting alcoholic beverages is also recommended, and if you are using marijuana, it's important to discuss this with your doctor. Older adults may be more sensitive to the side effects of this medication, especially dizziness. If you are pregnant, it's important to use this medication only when clearly needed and to discuss the risks and benefits with your doctor. It's also important to consult your doctor before breastfeeding, as it is unknown if this drug passes into breast milk. It's important to be aware of potential drug interactions with Felodipine Er, as they can change how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not make any changes to your medication without consulting your doctor first. Certain medications, such as azole antifungals and macrolide antibiotics, can affect the removal of felodipine from your body, which in turn may affect how felodipine works. Additionally, some products may contain ingredients that could raise your blood pressure. Be sure to inform your pharmacist of all the products you are using and ask for guidance on how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen/naproxen. If you suspect an overdose and the person is experiencing serious symptoms like passing out or difficulty breathing, it's important to call 911 right away. Otherwise, you should contact a poison control center immediately. In the US, you can call 1-800-222-1222, and in Canada, you can call your provincial poison control center. Symptoms of an overdose may include severe dizziness, slow heartbeat, and severe weakness. It's important not to share Felodipine Er with others. You may also benefit from lifestyle changes such as stress reduction programs, exercise, and dietary changes. Talk to your doctor or pharmacist about these changes. Make sure to have your blood pressure checked regularly while taking Felodipine Er. It may be helpful for you to learn how to monitor your own blood pressure at home. Discuss your blood pressure readings with your doctor. If you forget to take a dose of Felodipine Er, take it as soon as you remember. If it's close to the time of your next dose, just skip the missed dose and take your next dose at the regular time. Don't take a double dose to make up for the missed one. When it comes to storing Felodipine Er, make sure to keep it at room temperature, away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. If you no longer need the medication or it has expired, make sure to properly dispose of it. Do not flush it down the toilet or pour it into a drain unless instructed to do so. It's best to consult your pharmacist or local waste disposal company for the proper way to discard the product. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.